Lower back pain affects 80% of the population at some point in their life, and 1/3 of the population suffers on a yearly basis. The lower back is the single most common cause of disability in workers under the age of 40. Your lower back is made up of 5 bones, called vertebrae, stacked on top of each other with a soft, shock-absorbent disc in between each level. The spinal cord lives behind the vertebra, and nerve roots emerge from openings on each side. There are many causes of lower back pain. Two of the most well-known culprits are lumbar disc lesions, where disc material bulges backwards, potentially irritating sensitive spinal nerves, or lumbar degeneration, where the disc is deteriorated and thinned over time, thereby encroaching upon the opening where the nerves exit. But one of the most overlooked causes of back pain comes from a slightly restricted joint. To help understand this process, imagine a normal back functioning like a spring that moves freely in each direction. A back with a joint restriction is like having a section of that spring welded together. The spring may still move as a whole, but a portion of it is no longer functioning. Joint restrictions develop in a number of ways. Sometimes they're brought on by an injury, like a fall or an auto accident. But more commonly, restrictions develop slowly from repetitive strains or poor posture. And joint restrictions give rise to a self-perpetuating cycle of discomfort, beginning with swelling and inflammation, which triggers painful muscle guarding and leads to more restriction. Joint restrictions most commonly cause local tenderness and discomfort, and you may notice that your range of motion is limited and that movements intensify your discomfort. Pain from a restricted lumbar joint often trickles into your hips or thighs. Long-standing restrictions may result in arthritis, in much the same way that a slightly misaligned wheel on your car causes premature wearing of your tire. Fortunately, chiropractors are very good at relieving lower back pain with tools like therapy modalities to help release muscle tightness and decrease inflammation, myofascial release to massage out trigger points in chronically tight muscles, and exercises to make your back more flexible and stronger. But chiropractor's unique remedy is the ability to restore movement to restricted joints with gentle spinal manipulation. Various studies comparing manipulation to medication or physical therapy concluded that chiropractic patients recovered faster, with greater pain relief, and better quality of life. It's no surprise that many prestigious medical groups have published papers endorsing chiropractic spinal manipulation. So if you or someone you know is suffering from lower back pain, trust the safe, effective, natural alternative first.